Good afternoon. Welcome to Thriving Thursdays, Hope, Health, and Healing in Communities of Color. I'm Charmain Jackman. I'm the founder of InnoPsych, and I'm excited to bring this program to you today. This is our second session, our second live chat. Today is this month is Mental Health Awareness Month, so I'm excited. That's why I'm wearing green today. So really excited to bring some more programming to you around mental health awareness and healing. So just to share a little bit about me, I've been in the field for over 23 years. And the thing that I'm really getting passionate about these days is really about changing the cultural narratives that we have about mental health, particularly in communities of color. I've seen a real big shift in people looking and wanting to get therapy. And I think it's really important to highlight the work in our communities where people are really advocating and making positive changes in their community. And that's why we're bringing Thriving Thursdays. It's really the goal is to highlight professionals, mental professionals, and mental health advocates who are doing positive things to change the messages that we've had around mental health. My energy really comes around creating programming and initiatives that intersect both mental health and diversity. In January, I launched a national online directory. It's called, InnoPsych. It's a therapist of color directory. And the vision of that is really to change just the images that we have of therapists. I want you to see the multicultural and diversity that we bring to the field. Even though we represent less than 15% of all mental professionals, there's still a wealth that we can bring, and we really want to showcase that. We've seen a huge jump in our requests for therapists in the recent events with COVID-19. And so we're signing up new therapists every day. So if you are a mental health professional, we encourage you to check us out at InnoPsych.com, join directory. And if you're looking for a therapist of color, that's the other place you can go to there too. In addition to therapy, we offer a range of events, again, that focus on promoting emotional wellness and mental health. And I'll show some of those to you in a few minutes. We also really invested in therapists themselves. And so we bring some entrepreneurship courses that help you grow and launch and grow your business. So we're trying to tackle this issue from both ends in terms of making sure that we have a supply of culturally competent professionals who provide high quality mental health care. So what I want to do right now, just to remind you, we will be hosting the Thriving Thursdays every Thursday in May. It's typically a monthly event, but because it's Mental Health Awareness Month, we want to make sure that we brought more messages around mental health to you. So first I'll introduce Dr. Lavanya Devdas, who is a licensed psychologist both in Pennsylvania and New York. She has a private practice in Doylestown, Pennsylvania, where she primarily sees adults in therapy practice. She uses an integrative approach where she treats anxiety, depression, and relational challenges within the context and lived experiences of the individual and their respective families and social environments. She's also an advocate for addressing mental health needs and coping at the group and communal levels, including communities of color. And Mr. Kwame Dance is a mental health professional and advocate. He is a doctoral student at William James and provides therapy. I think he's in his office right now at Whittier Street Health Center in Boston. He's also involved with the Behavioral Health Services Coordinator at Cambridge Community Center and the founder of the Advancement of Culturally Competent Education to Stop Stigma, the Access Program. As I mentioned, in his 15-year career in human service program development, implementation, and evaluation, Kwame has demonstrated a commitment to solution-focused change agency, which is fueled by his passion for multi-systemic diversity, equity, and inclusion. He frequently conducts workshops and lectures on mental health, disparities locally, nationally, and internationally, and is a regular mental health guest discussant on several media platforms. So we welcome both our speakers, and before we do that, we will share our results from the poll with you. So we have 56% of folks are not mental professionals, And for the most part, people are kind of in the middle. They're doing okay. So thank you for being here, and hope that maybe that number rises by the end of our program today. All right. Thank you. So just as you know, we'll keep the mute on as we talk. I will be asking our speakers a number of questions, which they'll respond to. If you have questions that come up, please share those in the chat, and we will get started. So I like to start, there's this quote that I like from Maya Angelou, which actually inspired me to kind of start this Thriving Thursdays. And it goes like this. So I'm gonna try to embody Maya right now. My mission in life is not simply to survive, but to thrive with some compassion, some passion, some humor, and some style. So I'll first open it up to our speakers. So Dr. Devdas and Mr. Dance, how do you resonate with that quote? What does that quote speak to? How does that speak to you? We'll start with Dr. Devdas.
Okay. First of all, it's great to be here. Thank you for doing this much needed outreach today. Hi, everyone. This is Dr. Lavanya Devdas. And what that quote means for me, it really embodies such an inspiring essence of life, meaning that the use of compassion towards ourselves can grow bigger to be able to channel that sense of compassion towards other people. And that can be such an antidote to the uncertainty and to the past and the future. And it talks about the passion for just living authentically to me and just being able to connect to the present and share yourself authentically to others around you in this moment. And to be able to laugh at our own weaknesses so that we don't take life too seriously. For me, at least right now, you know, the pandemic has taken a toll at such countless levels. And for me, it's also giving me the message, and hopefully to those that I'm working with, that we were never in control to begin with. So to be able to take that part of the experience and use humor and compassion and passion to connect with the moment most authentically, that's what that means to me.
Thank you for sharing that. I love that.
You're welcome.
Kwame?
Yes, that was awesome. First off, hi everybody. Again, I'm Kwame Dance. Thank you, Dr. Jackman, for having us and creating this platform. So that authenticity piece really resonated with me. So yeah, so just being able to move through life in the most fulfilling way you can, most gratifying way possible. You know, we're gonna have bumps and blows like we're having right now, but to thrive isn't, to me, it's not. We're not focused on the. I think the sort of the term we use synonymously with thriving is achievement, and I think that is defined differently by the individual. So that's where the authenticity piece comes in for me. I think living with integrity, despite those bumps and blows, is part of what this quote is speaking toward. And of course, just doing it with style. So it's like living with integrity plus one. It's going through life, just, you know, taking the blows and looking good doing it.
Love it. Yeah, I just love that. I think it just, like you said, like you both mentioned, it just embodies just doing you, right? Doing you. And I love the part about not just surviving, because I think in our communities, we've all in the past had a message about, I'm just trying to survive. You know, we're just trying to make it. And I love that, you know, she's calling us to we're not just going to survive. Like, how are we thinking about the next generation? Like, we need to thrive. We need not to just survive. And I love the humor part, because I try to bring that into my own therapy sessions. Like, I think therapy work is hard, but it doesn't have to be so serious. And so how do you bringing our full selves into that space? So I just love that. She has a number of quotes that I'm going to be posting this month. So very cool. All right. So tell me a little bit about, I always love to start with purpose. So tell me a little bit about why you got into this field. What was your calling? What was that moment or that defining moment for you that like, this is what I want to do? We can start with Mr. Dance. Kwame.
So so first off, I've always wanted to be a psychologist. I'm like one of those people that was just exposed to the field very early. My mother was in office, managed an office it was a behavioral health office where there were quite a few very, very well-known psychologists doing research. So I was a little kid running around looking up to a whole bunch of psychologists. So I just figured that's what I want to be. But in terms of connecting to my purpose, I was in a workshop once. I used to be a youth program director in Cambridge, and I was in a workshop, and it was about finding your why statement. Why do you do things? So we just kept plugging away. And the activity we did is every time you said, what do you want to do? What's your purpose? The other person would just ask why, until you got down to a root 1 or 2 words that just were your why words, your why statements. And mine were change and impact. And merging the two, I felt psychology and mental health work was the opportunity to do that in a very, to create change, positive change, and make an impact in a multi-systemic way.
Very good. How about for you, Dr. Devdas? No, unmute. MC, unmute.
I keep forgetting to do that. Thank you. For me, I think I've grown up in India. So I've grown up in a very collectivist culture. And part of being in a collectivist culture and experiencing those familial values was about nurturing and taking care of other folks. And to be able to do that, my grandparents basically would say, if you haven't had dinner and if somebody else is hungry, you better learn how to share. You don't get to think about yourself. You get to think about other people. And so I think that kind of value drove me very early on, understandably, to a field that represented those very values. And one of the biggest challenges for me was, and rewarding journeys for me in choosing psychology and to be a therapist, was I started off as a social worker. And in social work, it's all about hands-on, connecting folks with resources and dealing with people in ways that they're used to or depending on their own access to resources. So it looked very different for 2 people living in the same environment, and yet my approach towards them automatically felt very different. And I thought I needed to know more about this. And that's what led me to doing a doctorate in psychology in States is to understand that yes, in philosophy, in theory, we're all equal, but we're really not, because our lived experiences and access to those resources can feel so different. And so it was a combination of family values, cultural values, and my experience as a social worker that led me towards psychology, but more so with the intention of integrating social justice and multiculturalism into psychology. One of the things that I say was very rewarding was caring for other people came very easy to me, because that's what I've grown up around. And what psychology taught me was you need to figure yourself out too in the process. You can't keep focusing on other people. And for me, that was the biggest gift that psychology and social justice could have given me, because it's important for me to know my own strengths, my own areas of growth, before I can share my authenticity with other folks. And so for me, that would be the essence of why I chose what I'm doing right now, and I love it.
Thank you. That's so powerful, and I appreciate you saying that. I see some people clapping. Thanks, Samuel. So also, yeah, please feel free to make comments. I know some people responded to the quote, the Maya Angelou quote. So if if you want to share how you connect to that, please, we'd love to engage in that way. But yeah, thank you. I think I just loved hearing kind of how people got into the field. For me, I was 15 years old, living in Barbados, never met a psychologist in person, saw some on TV, but the idea of just being a place like a sounding board for other people. And my goal was to be an adult that other kids could talk to, because I didn't have that growing up necessarily in my family. And so I wanted like adults to have a trusted adult that they could come and talk to about anything, sex, whatever it is, right? Without judgment. And so that's how I ended up at high school. So, but yeah, I think for us, it's really important to connect with that. What is our passion, right? What is the hope that we hope to change, to bring to our communities and change? And so you've both spoken about that really highly, and how from very young that was there, right? It was a seed planted from very young for you.
Yeah.
Thank you for sharing that. So I want to move into health, because I know there's so much to talk about and the time goes so quickly. So I want to talk a little bit about health, in particular mental health. And I think we can't ignore what's happening in the backdrop, right, for us in terms of coronavirus and our quarantine and social physical distancing. And so one of the things that I was really connecting to, and I knew it would happen, right, that we saw very quickly the disparities that were happening for people of color around the impact on coronavirus and treatment and access to care. And we know this history of systemic racism. We know that that was going to happen, right? And we just kind of knew it because it's already there. It's already present. So of course, we would be disproportionately affected by the coronavirus. So I want to kind of get your thoughts about, prior to COVID-19, what trends were you seeing in people of color using therapy, right? I'm curious, what were the things that you were seeing in your own communities about people of color or people in your community accessing therapy? We can start with Dr. Devdas.
Okay, thank you. So prior to COVID-19, I worked at college counseling centers in the US, and I currently also see emerging adults who are also part of the university and college settings. And prior to COVID-19, there was more of a hesitation to reach out to a therapist because there were some things in the environment that were still accessible. And what I mean by that is, if you wanted to go for a run and exercise was your thing, then you would rely on that. You would rely on your peer support. You would hang out in person. You would be able to communicate more freely with your family members, your extended family members, and outreach was a common event across most college counseling centers. So being able to attend outreach interventions such as stress management, where multiple folks from from communities of color would come in, learn those strategies, and then disperse to implement it. So I sensed an improvement, and yet at the same time, a hesitation to reach out to therapy. However, the folks that came in, mostly because of academic concerns, because that was an important value that they placed or their family placed, they would come in and then they would say things like, this feels different, this actually feels good. And I didn't understand what that meant, because I thought I was not doing anything differently, because I thought I was bringing part of my culture. I was integrating that with who I was as a psychologist, and I was integrating those into therapy. And I thought that's what usually needs to be done. So when they said, I don't feel like you're prescribing anything to me, I don't think that you're telling me what to do, or you are approaching my concerns with, let's say, a very existential focus or a psychodynamic perspective. And the feedback that I repeatedly heard from students of color and people of color was, my lived experiences matter to me. The environments that I interact with and go back to matter to me. And so I specifically remember, especially when I was dealing with a family situation where there was violence involved, I was being feminist and I was using an empowerment approach. I was also mindful that this person needed to go back into the family. It's a joint family where there are extended family members living under the same roof. And so I can't employ a feminist approach decided by the Western model, which talks about independence and which talks about, autonomy. Yes, they're important, but in some cultures and values, like for in that client's case, it was interdependence. It was not an independence. It was autonomy and keeping your loved ones close to you. So it was not complete autonomy. So I think what helped the students of color was knowing that therapy can be contextualized to values and preferences of culture, their family, and the reality that they have to go back into those environments after therapy. So really contextualizing and the person environment interaction can go a long way for students of color and people of color to understand therapy in a different lens. And I'm very grateful to be able to integrate their culture and therapy together.
Thank you. That's such a great point. And I think there are people in the past did not experience that. They felt like they had to leave their culture at the door, or people didn't understand, or they had to explain their culture to their therapist, which is like, I didn't come in here to teach you, like, like that's not the work I'm trying to do. So I think you're so spot on in just saying when people experience that, like, I don't have to explain myself. I don't have to explain my identity. I just come in as I am, and I can talk about what I need to talk about. And there's also not a lack of knowledge about my cultural context and what's going to work for me. There are not going to be recommendations or suggestions that are so far afield. I'm like, why am I here? This is a waste of time. So I think that's really important. And you're just reflecting what people are experiencing when they have therapists who are culturally competent, who understand culture and can bring that into the session. Kwame.
Yeah. Let's see. Before COVID, so I've worked in a number of settings with adolescents and emerging adults, both in outpatient and in school-based settings under the tutelage and training of wonderful psychologists, Dr. Jackman. I trained at her high school. And some mixed bag. I mean, you definitely saw you see the barriers to access, and a number of students I've worked with have had negative experiences with therapy. Either they were forced to go when they were kids and ended up in front of somebody that didn't look like them and didn't speak like them, that they really couldn't relate to. It was it's something they had to do as opposed to something that they wanted to do. So they came in with quite a bit of stigma. Some of the adults the adults of color that I've worked with are also still holding on to some of the same stigma. Yet I find with my adults and in outpatient, community mental health, they're coming with significant need. They know that they're hurting. It's just a matter of who and having an opportunity to sit in front of me. Even at my current clinic at Whittier Street, I'm the only male of color that's here. We have a lot of clinicians of color, but sort of, being that person that can kind of bridge the gap and show them a new look on what therapy is, still using evidence-based practice and modified evidence-based practice that's culturally competent and sensitive and curious, but using the evidence nonetheless. But being able to do it in a way that's relatable has been my go-to. So I just always try to combat that stigma and those barriers to access. Since COVID, I've seen.
Before you move on, can you explain what evidence-based practice is for people?
Yeah, what's that? Okay, so yeah. Mm-hmm.
You got it.
Yeah. I'm sorry. So evidence-based practice are, these are versions of psychotherapy that have been shown to be effective for whatever population they were tested on for very specific mental illnesses, to treat specific mental illnesses. So a popular one that we talk about that you may hear mentioned often is cognitive behavioral therapy. So that's that's used across the board with a lot of different mental illnesses, where you're adjusting to change a behavior, you're adjusting the way that a person thinks about the emotion that's associated with the behavior. So you're operating within the triangle of feelings, thoughts, and behaviors, and you're adjusting one to impact the others. So these practices are, like I said, proven, but a lot of times the populations that they're normed on are predominantly white or all white, and they need, Lavanya was talking about collectivism, and a lot of these cultures, like Eurocentric cultures, don't have that collectivist worldview. So these therapy models, what I found, I went to Kenya, and I was using a strength-based evidence-based model, and they didn't even understand what it meant to identify individual strengths. They completely got, the kids I was working with completely got the concept of collective strengths. Like their village was loving and caring, and but they couldn't even identify their individual strengths because that wasn't part of their identity. They connected to their cultural identity and what they meant to the entire system. So modifying therapeutic practices to be able to integrate, collectivist cultural identities, and that's what I'm talking about in terms of just modifying the evidence base, and that needs to happen in order to keep people engaged of color.
Thank you. So yeah, so what do you think, what do you expect to see post-COVID, or when the quarantine is lifted for communities? I know there's some communities that already have that lift. What do you think is going to happen in terms of mental health utilization among people of color?
So what I've started to see is because so I also work in another setting, which is it's where I'm training this year, which is a clinic that, it's a specialized clinic that's really boutique. It offers assessment and treatment for clinical high risk of psychosis spectrum disorders. So these are people that are identified as having a predisposition to a psychosis spectrum disorder like schizophrenia or others. And to even get identified before you present with a full-blown psychosis spectrum disorder is a privilege. So we don't see a lot of clients of color in that setting. And what I've found in terms of telehealth and virtual sessions is they've been able to, those clients that have that privilege have been able to adjust to teletherapy very quickly. Whereas here at Whittier Street, where I am now, which is located in Roxbury, which is a predominantly Black and Latinx community in Boston, I'm still seeing the majority of my patients in person here because of barriers to technological barriers and things like that. Now, what I also have seen is the folks that have been able to take advantage of our virtual sessions are much more compliant because they don't have transportation barriers and childcare barriers to access us on a regular basis. I am seeing an improvement in attendance, but I still see that as being a barrier, the technology barrier.
Right, and for some people, even though they may be able to have access to the sessions, they may have other people in their living spaces that impacts privacy.
Right, right.
Yeah, yeah. How about you, Dr. Devdas? What are you seeing in terms of, or what are you thinking is going to happen? Maybe what you're seeing in terms of your own clientele right now, but what do you expect might happen once quarantine orders are lifted for communities?
I think echoing what Kwame said, what I'm also going to add is I see a hybrid. I see that technology is going to be more active in terms of applying therapy, because I do think that there are a lot of working moms who right now are in limbo with their jobs. And I think my hope is that post quarantine, that this gives them increased accessibility to be able to access therapy with me online, because they do have access to a computer and they do have access to Zoom sessions or other venues. The other piece that I see happening is I foresee that for communities of color, more than accessing therapy, they might want to access more of their extended family support that they have not been able to be with in person. So I see therapy going more towards the outreach front post COVID-19, because people want to work in groups, people want outreach efforts, people want to have that rekindled sense of belongingness, that sense of connection with one another. So I see a spurt or a growth in community-based or group-based interventions. What I also see is another subsect of the population where, having been in limbo or having been laid off, their priority is going to be getting their basic needs met, which means economic stability, making sure there's housing and food on the table. So for folks who might be struggling to reintegrate, therapy might not be their number one priority. And that's okay, because they're getting their basic needs met from the scratch. So finding ways to take therapy to them, I think, would become more important post COVID-19.
I'm really hearing you talk about meeting people where they're at, right? And what are going to be people's immediate needs for community. And that could be definitely a place where we can reach out and connect with folks. One of the things, I was having a conversation with another colleague recently, we're talking about just kind of maybe potentially seeing an increase in social anxiety or agoraphobia, people who are afraid now to leave their homes after being quarantined for so long.
Mm-hmm.
So just thinking about some things that may have come up for people, that
Mm-hmm.
reentry into community might be really challenging.
It
And
is.
what might that look like for folks? So
Yeah.
all right, very good. Okay, so we're going to move on to our healing section. We want to make sure we have some good time left for conversation. Let's see, here we go. I have so many questions here. So let's talk a little bit about some of the work that you're doing, and how do you have a lens around healing in your work? Like, what is, kind of the goal? I know we've talked, and I know that that's a big mission in your work. So how do you communicate that to the people that you work with? How does that play into the mission and the interventions and initiatives that you start or you align yourself with? And Kwame, you want to start?
Sure. So even the language shift to healing versus some of the language that's been used in the past that carries stigma with people of color, even just mental, even mental health. The word mental often is a trigger or a barrier. So the fact that we're calling spaces or creating spaces called healing spaces sort of taps into what I was talking about earlier in terms of just reframing what therapy looks like. So I think some of the initiatives that I'm involved in at my alma mater, my high school, Cambridge Richard Latin School, we're developing healing spaces. We're calling them healing spaces at the high school where young people can feel free to process through restorative justice circles and other activities where they're learning mindfulness activities and practices to teach to each other so that they can heal themselves, and teach the adults in their lives how to heal. And this stemmed from some racial injustice at the high school, some race issues that had come up, and the need for this. This actually came into play before COVID, but so that would be one. I'll talk a little bit about my program, the Mental Health Access Program that Charmain mentioned earlier. It stands for the Advancement of Culturally Competent Education to Stop Stigma. And part of it is career exposure for teens to mental health professions, but the other piece is mental health literacy. So we're doing psychoeducation, and a big part of that is mindfulness. Learning mindfulness practices, and not just how to be more mindful and how to benefit from mindfulness, but also how to teach it and facilitate mindfulness groups and coach. And we had an excellent mindfulness coach, Nael Judy, who's going to be on an event that I'll be talking about shortly, as well as several mental health professionals that have just helped these young people to be able to help themselves and heal themselves in their own community.
Great, thank you.
So I think just to add to that, Kwame, I was so happy when you said mindfulness. I was like, yes. So I think I can't stress on that part enough in relation to healing, because mindfulness can be very simple and it can be very complicated. I say that in relation to, I'm a huge practitioner of meditation and mindfulness. I implement mindfulness in almost every session with what my clients are bringing into the table, with the anxiety, the social phobias, the uncertainty, coping with fears, death and dying and suffering. And so connecting, like going back to that Maya Angelou's quote in the beginning, connecting authentically in the present becomes all the more prominent in terms of healing. So understanding what we have control over and what we don't have control over, and staying in the present moment using those mindfulness-based strategies is something that I want to do more of than what I'm already doing. In fact, I offer meditation sessions for folks who are struggling with the uncertainty and fears. I do have one on uncertainty and compassion on Insight Timer. And I was blessed to see people's responses, more so because I just wanted to put it out there. I wasn't doing it with the intention of any particular outcome, but I'm blessed because there were so many folks who had listened to it, which told me that there's such a great need for it, to apply it, to learn about it, to implement it as a community. And when we do it as a group, and when I introduce it as a community, it has so much more collective power than doing it individually. So I will add that where possible. I recently did one for folks. I paired up with my colleague, and I did one for folks in China who are really struggling, and the impact and the relief that they got, because they're also dealing with a lot of stereotypes. They're also dealing with a lot of racism, given the details of the COVID-19. And I can't yet say his name, but he's the dude who appears on media, television. He's the president of the United States. I can't say his name. But, you know, the impact that he's had on so many people, the divisiveness. So not focusing on that, but understanding my own reactions to how that impacts me, how that impacts us as communities, as especially people of color. The health disparities that have just blatantly come to the surface, or increased because of COVID-19, rather. I think just holding all of that in your own strength, in that own vulnerability, needs a lot of mindfulness. And so for me, healing is about being present, being authentic, and understanding our own responses to what's happening around us, with the caveat that there are systemic factors in the environment that do inform how we respond differently. So, yeah. Thank you.
I love that. So it's such a great place to end the thinking about mindfulness. And can you give a brief, I know you've defined it, but can you just give a brief for people who may not be familiar with the term? How do you describe it? And I love that you added that context to it as well. And maybe a couple things that, you know, we can maybe end with a quick mindfulness activity for people today. I think that'll be really cool. But maybe some things that you do in your practice, just name a couple things that are within that practice, just to give people examples of what that looks like, what it looks like.
Sure. So part of my therapy work is also integrating the mind-body approach. So in therapy, mindfulness can look like, how do you feel your breath in your body right now? Are you able to use the flow of energy through your breath to anchor your body? Can you feel the stillness? And once clients have developed that connection to stillness through their body, I'll ask them to gently invite, with compassion and with non-judgment, their relationship to the fear, their relationship to the future, their uncertainty, and being able to ground themselves amidst that fear and uncertainty to understand better how they respond to what's happening around them. So that's just one example of how I use mindfulness. And a quick orientation, mindfulness is about just observing through your senses, describing through your inner thoughts about what's happening for you in this moment. Thoughts, feelings, and sensations without judgment, with acceptance, and with compassion. So that is the foundation of what mindfulness might look like. And I'll be happy to lead maybe a quick mindfulness session if we have time for it.
Okay, great. Thank you so much.
You're very welcome.
And I love it. I use it with clients. I use it with my teenagers. I think it's something that they can really grasp onto, and particularly some of the grounding techniques. They're really easy for them to learn and practice. I think I will be, there should be by now, there's a guided imagery, a guided meditation that I have on my website too, the favorite place imagery. So there are lots of different tools out there that you can do. There are lots of different apps. We can share some of those as well. So let's see. Anything else? I mean, I think one of the things that we get the question, so we'll leave this question and we'll open up to the participants. What do you say to people? I think I get this a question a lot. What do you say to people who are reluctant to seek therapy as an option for healing? Or what might, you know, some of the people here, what might they say to a family member or friend about how valuable therapy is in terms of starting that healing process? Dr. Devdas,
yeah, so I think what I would say is therapy is not what it looks like on television shows. Please don't use that as a basis to understanding therapy. To be mindful that when you hear things like you must be crazy or there's something wrong with me that I'm needing therapy, that there's a lot of stereotypes and connotations associated with the language used to describe therapy. And therapy is not one size fits all. It can look like a typical therapy session for one person, and it can look like a culturally sensitive approach to another person. So it's very different. It depends on the individual. And please don't go by one size fits all for therapy. And if I had to introduce therapy to my family members, and believe me, that's a test. I mean, I'm able to talk with them when I say, and the jargon that we use around therapy, like loosening up that jargon, sometimes it's about you talking with me and me talking with you in a collaborative way to figure out what best healing methods work for you. And other times it's going to be like, as a professional, here are some responsibilities I have. I talk about confidentiality and limits to it, but in a language that the client or clientele can relate to. So moving away from that jargon, I think, can go a long way.
Yeah, all of that. And add to it, and I'm going to let's try to use the chat function a little bit for this. How many of people that attend therapy, how many sessions would you all guess that is the average amount of sessions that folks will attend, that do attend therapy? Let's see. Anyone in the chat?
So you're asking what's the average number?
The average amount of sessions that an individual might come. Okay, no clue. 5, 6, 3 to 4. It's 1. Because we have so many people that'll go and not come back because they have a poor experience with a therapist. And one of the things that I say to folks that have had this negative experience or are worried that they'll have another negative experience is therapy, again, it's not one size fits all. It's a relationship. It's just like any other relationship or friendship, and except it's, you know, the individual's benefiting from it, so it's a little different in that way. But in terms of building that connection with somebody, it takes time. I usually tell friends and family and people that ask me about what the benefit is and if they feel it's worth it, I encourage them to try, but not just try a first session. I encourage people to try 3 sessions unless they're completely turned off. And I try to explain what therapy looks like. At first, you're doing an intake or initial assessment, and that can feel more clinical, and that doesn't feel all. I mean, there's certainly ways of doing that and being sort of semi-structured and not being stuck to a sheet of paper and a checklist. So there are ways of doing that are more engaging, but sometimes it doesn't feel that way to the individual, which can be off-putting. Then you're doing your treatment planning, which can also not always, it's more collaborative, but it doesn't always feel as, you don't always feel as connected, I've found, in certain situations. But then you get into the meat of it. After you've been there for 3 times, you sort of get a feel for that person, they get a feel for you, and you can match styles or leave.
Yeah. Thank you. That's great. I love both those suggestions. That it definitely, people do tend to get turned away after the first time. And I do tell people it's because you have a bad experience. It doesn't mean that therapy doesn't work. It just means that relationship doesn't work. It's just as if you're going out on a date and the first date wasn't so hot. You know, you may or may go on a second date. So it's good to give it a second. Open up to the chat if you guys have questions. We'd love to hear. Thank you so much for your engagement through this. I can't believe that it's almost time to close out. So yeah, what questions, observations? I wanted to go back. I know, Samuel, you mentioned that when we were talking about what might we be seeing once quarantine lifts, you talked about, increase in alcohol sales and worried about substance use. Yeah, so, this is kind of open at this time. There some other mental professionals on the chat. You have 3 here, so if you have questions, please reach out, thoughts. Yeah. Observations. Yeah, Susan is saying, yeah, it makes a difference who the therapist is. And I think one of the things that I really work on whenever anyone comes in to see me, I have a conversation about, from the very beginning, this therapy is a relationship, and we may not connect, and that's okay. And if you want to give me a try, let me know, and I can see if I can adjust, right? Because I'm also learning you. But if it really doesn't work, I have a network of people that I can refer you to, and so I don't take it personally if this doesn't work out. And I really try to give people that language and live that language. After the second or third sessions, I say, so how's this feeling? What's working? What's not working? Right? So I'm open up that conversation so we can talk about it. What about non-traditional venues for therapy? Does it have to be in an office? And that's a great question. Kwame is not in that, so I'll let him jump in. But I agree with that. So I know there's a movement towards people do walk-in therapy. When I trained at Children's Hospital years ago, one of my supervisors used to take kids out on the basketball court and do a group on the basketball court around social skills. So I think in some ways our insurance companies limit. It's almost you have to be in an office for therapy to be official or to be valid. But there are definitely ways to be creative around that. And I'll jump in and let Kwame and Dr. Devdas respond to that too.
Yeah, like Charmain said, it does depend on the setting, and insurance does factor into that for sure. I've done walking sessions. I've done the basketball court thing and all of that. But I mean, that's one of the things we're discovering and exploring now. I mean, and you know, I do think that a lot of this is gonna stick. We're doing virtual sessions now. That wasn't a thing before, and that's covered for Massachusetts folks. Mass Health is reimbursing for that, which is our affordable care. So clinicians are getting creative. Insurance companies are seeing the benefit. Healthcare politicians are seeing the benefits. So I do envision this changing the way we deliver services moving forward.
I'm going to quickly say that definitely I agree with what both Charmain and Kwame have said, and that I do think that we do need to explore non-traditional ways of doing therapy. I remember even pre-COVID-19, I had a student of color, and this student had social anxiety issues. And coming into the office and sitting with that pent-up energy of anxiety and not being able to move around a lot was really detrimental to this particular student of color. So I asked permission from my supervisor, and one of the things we did was she identified empty classrooms, and we would walk to those empty classrooms week after week. During our sessions, we would do therapy en route, and it became exposure therapy, and it felt a lot more normalizing for her to be able to talk about her fears while physically expending that anxiety, and walking with her therapist was all the more normalizing and empowering for her. So I do think that we actually need to consider non-traditional ways of doing therapy, because it's with the globalization of psychology especially, I think there's a lot more to doing therapy in the office one-on-one, not to take away from its benefits, and to say that there are other ways of reaching a larger global audience or a population in need.
Wonderful conversation, Kwame and Lavanya. So I appreciate you spending this hour with us to share some of the work that you're doing. I love doing these because I get inspired and I think about, okay, what else can I do? How else can I help and contribute? So just thank you all for being here and contributing to this conversation.
Well, thank you so much for having us. Well, I'm speaking for you too, Kwame.
Yeah, definitely.
Thank you for having Kwame and me. And it's been an absolute pleasure because like you, Charmain, I get very excited and inspired by all the work that we're all doing together. And I'm hoping that we continue to do this through InnoPsych, and this becomes a safe space to be able to talk about conversations and topics that are very, very important to all of us. Yeah. So thank you.
Thank you. Kwame?
And ditto.
Okay, great. Thanks all. Take care. See you next week.
Thank you. Take care.
Bye.
Yes. Thank you, everyone. Take care. Bye.